I'm Maggie Olander, and this is my presentation on phenylketonuria, or PKU, and its effects on the digestive system. So, without PKU, this is how the digestive system should work. The digestive system performs metabolism, which is the process of converting what we eat or drink into energy. This is necessary to sustain life, clearly. Food that we consume or drinks are broken down into smaller molecules in the digestive system. So it's digested in the stomach, and then those nutrients are absorbed in the small intestine, and then they are distributed from there. Sometimes enzymes are required or helpful in this process. Enzymes are substances that expedite a chemical reaction without being used up. So it's something that is normally produced by the body that helps the whole process of digestion and assists the digestive system in that way. They are often made in the pancreas, the liver, the small intestine, mouth, and the stomach. If they are missing, the process of digestion and absorbing the nutrients can be damaged drastically. In phenylketonuria, or PKU as I'm going to call it now, the enzyme that is missing and is impairing a process is called phenylalanine hydroxylase. You can see it in the image over here. It is normally made in the liver, and it breaks down phenylalanine, which is an essential amino acid that is absorbed from the small intestine that comes from high protein foods. Phenylalanine is needed to create proteins in the body for growth and development of the human body, and we have to get it through protein in our food. We can't make it in our body, so we have to get this essential amino acid in order to properly grow and develop. Once we get phenylalanine, it's supposed to be converted to tyrosine, which then converts to neurotransmitters, which are vital to the central nervous system and its function. It's a necessary process for phenylalanine to be broken down by phenylalanine hydroxylase, and you have to have the enzyme for it to be broken down. Otherwise, the toxic levels are going to build and PKU results. There are dopamine, norepinephrine, and serotonin deficits. Those are the specific neurotransmitters that are necessary and will not be developed if PKU is present. A little bit about the cause of PKU. It is a genetic cause. It is an autosomal recessive disease. There are often parents that are unaware that they are carrying it. They may be a carrier, and so they're not going to present the symptoms. It is actually possible for a child to be a carrier and be homozygous, which is kind of surprising. That's not often how it works. They have to have the mutated versions of the PAH gene in order to actually present as a PKU patient. And there's an unknown ethnic risk. They don't really know if being of one descent or another actually raises or lowers your risk of developing PKU. How do we know when someone has PKU? They tend to have fair skin and blue eyes because the body is unable to make melanin due to those neurotransmitter deficits. They will have a musty odor of their breath, skin, and urine, and amino aciduria. Both of those are due to the accumulation of the amino acids being unable to be broken down. And then hyperactivity, developmental disabilities, anxiety, aggression, microcephaly, and seizures, and any other mental disorders are often seen with PKU as well, and these are all due to the lack of neurotransmitters in the brain. The brain can't function without those vital neurotransmitters like dopamine and serotonin, and so things are going to go wrong, and that's where the physiology is affected by PKU. Diagnosis comes through a simple blood test. It is always caught at birth if you are born in the U.S. because it's mandatory to have a blood test done on all infants. Otherwise, if it isn't caught at birth from someone born in a different country or something, you can again just test for it in the blood. Treatment of PKU most often involves diet. Diet is huge with this. You have to limit protein and fake sweeteners because those contain phenylalanine, and you're trying to just consume the minimal amount of phenylalanine possible. Often with babies and even adults, actually, there's a PKU formula that provides the protein necessary for development without providing extra phenylalanine. A lot of patients will take that. So with the diet, often PKU patients have to avoid milk, eggs, cheese, nuts, beans, chicken, beef, fish, and aspartame or equal, whatever you want to call it. Often sugar-free gum or diet sodas have the fake sweeteners like aspartame in them, so you'll have to avoid those if you have PKU. There are two other treatment options for PKU that are prescription drugs. The first one is Kuvan, which improves production of phenylalanine hydroxylase while also increasing the person's phenylalanine tolerance itself. It is a tablet that you take by mouth and has to be used with the low protein diet. And then Palynziq is actually a substitute for the enzyme deficiency. And so it's an injection that the patient takes once a day and doesn't necessarily have to be used with the diet, but it has only been tested and successful in adults thus far. They haven't used it in pediatrics yet. So these are both two options that have been FDA approved. For long-term effects with PKU, it really comes down to, unfortunately, continued damage to the brain. You just have to make sure you're following your diet and trying to keep your protein levels low so that there won't be the buildup of phenylalanine. Your entire health will be impacted, your mental, digestive, nervous, reproductive, and behavioral health, mainly due to those mental disorders that will likely come. Digestive-wise, you're just going to have to watch your diet, and reproductively, if you want to have kids, you just need to make sure that you're paying attention to the genes from both sides of the family so that you're not passing it on to your kids, hopefully. The good thing about PKU is it's not fatal if it's treated, but the cognitive and mental conditions are lifelong. Here are my references. Thank you for listening to my presentation.